April 28th. Whoops, my slides aren't advancing. There we go. So today we report out 429 cases, 10 total deaths, 18 in the hospital, 3 in ICU, and another 401 folks home outpatient. 132 recovered. That gives us a case fatality right now of 2.3%. As you all know, as testing expands, those numbers go down because we've been in a limited testing and originally in a strategically restricted testing format, and that is all opening up. So those numbers will change. Monitoring is our folks who are either traveled or otherwise known exposed, and we have those folks quarantined until we know that they do not become ill. So actively, we still have 224 that we are monitoring, and we have completed 433. So deaths, just a chart here that shows you we're at 132 recovered, 10 deaths out of our 429 total cases. Here is what our daily incidence curve is looking like. So as you can see, and I've been trying to kind of get you prepared for the fact that as we get down to these lower numbers, you'll see a lot of bouncing around, and that's where we have to have some epidemiologists do some magic to get us through this 14-day trend that needs to be going downwards in order to be part of that gating, that reopening. And so things like rolling averages and stuff like that I showed you last week, or I showed somebody at some point in time, are the way that we'll flatten or smooth that incident curve so that we can get a better look at what's going on. Also, as testing increases, we are going to have to look at the number of positives as a % of the total number of tests done. Otherwise, as testing increases and we have more cases, we won't be able to sort that out. So just our cumulative cases. So we're looking for this, to basically settle down into a flatter and flatter curve, as you can see that it's doing. Positive case by date of onset looks like this. I don't know why we have two curves, but here we go. And then looking at our maps, our zip code maps, we still say 48911, who are just, leaping out into a category of their own. 101 to 110 cases in 48911 alone, and it jumps down from that to where you see this next colored shading here, and then less and less there as well. So those are our zip code maps by cases, and here's what it looks like by rate. So still in Mason as well as 48911, and then because of the low population down there in Onondaga and probably a few cases, that jumps up in terms of a rate. I caution you again, we have to look at raw numbers in addition to rate if we're going to calculate rates for you at this point in time, because calculating rates on very low numbers is not as reliable. But I do like to share that we always have to take these data and look at them as a % of population as well, or as a rate by population as well, to really know what we're looking at. So we are still 50-50 male and female, and we are still in that 50 to 59 age group is our largest % of cases, but we're quickly catching up with 20 to 29, 30 to 39, and 40 to 49, kind of all across that age group, or those age groups. Our rate-specific prevalence is 336 for African Americans, 101 for Caucasians, 293 for Asians. So we are looking at people of color across the board disproportionately impacted as we see this outbreak continue. And that's been reported nationally. That's being seen in the city of Detroit. We're just seeing this across the board, every community, every city, every state, and across the country. So again, rates help you tell the story, since if we looked at this just by numbers, we would see that 50% of our cases are Caucasian and 26% African American, but they are not evenly distributed in our population, so we can't look at cases that way. Again, we have 96% of our folks home and 4% hospitalized. Our hospitalization numbers have been dropping this week, as have our ICU numbers been dropping this week. So your % in ICU now is 1%, 31% recovered, 3% hospitalized, and the rest at home, except for our 2% deceased, of course. So I want to talk a little bit today about and I'm just going to do this via PowerPoint because it's easier for me to follow and it's easier for you to get all the information. And so we have a racial disparities project and Black community support and partnership plan with the Ingham County Health Department to address these issues that we are seeing in our community. And Debbie is very involved in that group, as is Dr. Renee Kennedy, who's my predecessor, and I have asked her to join me on Friday to continue to elevate this conversation and get her reflection about what's happening, not just in Ingham County, which is her home, and again, this previously was her position, but statewide and nationally as the CEO of the Michigan Public Health Institute, to get a look at, or to hear from her about what she, is thinking and hearing and seeing as well. So here, our Special Populations Work Group has formed, and their mission, as you can see here, is to start focusing on mitigating the infection rate in the Black community through supporting and resourcing existing trusted relationships among leaders, Black leaders and organizations, to break down barriers, culture barriers, communication barriers, to the needed information and resources based on community-led efforts and community-identified needs. We're trying to decrease the rate of COVID-19 infection and hospitalization and mortality for Black and Brown people in Ingham County and increase access to those needed information and resources. So strategically, we've been providing critical and accurate and needed information, referral services, contact tracing and quarantine services, which we do obviously across the board, mapping assets and needs identified by our Black leaders and Black community members within the interactions of education and referral as we work with them, and strengthening our community-wide safety net for all communities disproportionately impacted by disasters and emergencies, because this is not new that this happens, and breaking down cultural and structure barriers needed for information and resources. By doing all of these things, so I overwhelm you with a lot of words right now with all of these things, but we have Debbie here to talk about them. So again, supporting, resourcing existing relationships, identifying and supporting and resourcing leaders in very different sectors in our community to improve the trust and strength of relationships as we contact them. And that includes churches, fraternities, unions, the LGBTQ community, media and business networks, co-crafting culturally appropriate and targeted messaging with a cross-section of Ingham Black media and cultural leaders to address specific concerns, and valuing the ability of our community to identify needs in their own neighborhoods and to improve the service agency capacity to respond quickly to emerging needs by literally taking their lead in how we work within those communities. We have launched a targeted campaign with radio ads recorded by the head of the MLK Commission and Magic Johnson, and that's running on Power 96.5. We are delivering fact sheets, and that continues, as well as more fact sheets to our free food distribution to local children and their parents. We're securing masks from seams and distributing a sign-up survey for follow-up on those indicating barriers to following COVID-19 health resources. Our special population leads met with Representative Sarah Anthony, as well as Commissioner Darrell Slaughter and Dr. Renee Kennedy, as I mentioned, who is working closely with them to engage the faith community and to create a special racial disparities faith task force to engage them. And then we're looking to do on-the-ground outreach to communities of color to provide those resources and messages and questions and answers as needed. We also have a strike team for the COVID-19 outbreak in our refugee community, with partnerships from the Refugee Development Center, St. Vincent's Catholic Charities, Family and Community Development Services, and other local partners with strong ties and relationships and cultural competency in communicating with newer and longtime refugees of Ingham County. It's important to remember that Ingham County's refugee population is substantial. We are a large refugee resettlement agency. 20,000 people come from dozens of places around the world and speak more than 94 languages in all. Cultural brokers and community partners with language proficiency and knowledge of cultural norms are absolutely critical in stopping this outbreak. And we did begin a phone campaign to contact refugee residents of Ingham County with information, and thus far we have reached over 400 of those families. So that is the end of my slideshow for you. Let me get back to, where are you? Here we go. Oh, stop sharing. There we go. I knew I could find it. So I am going to turn over at this point to questions and answers after dropping a whole lot of very verbose slides via PowerPoint to you. I didn't want to miss some very important things, and honestly, I just got that whole, bullet point of everything that was going on from Debbie a little bit earlier today. So important for me to be able to read it and make sure I don't miss anything, and important for us to have Debbie here with us today to answer a lot of questions about what's going on and what we're seeing and how we're helping in our community. So, questions?
Megan Banta.
So have there actually been any confirmed cases within the refugee population, or is this just preventive and taking early steps?
No, we do have cases in our refugee population. Debbie, go ahead.
Yes, we do have cases in our refugee population.
Oh, yeah, we're actually investigating an outbreak that's associated with a poultry farm in Ionia County. And there's a lot of refugees associated with that poultry farm and working there. And they work there, but they live in multiple counties. So Ingham County is one of those counties, as is Kent, Ionia, probably Eaton County, and a few others. So right now, I think the largest portion of our refugees that have tested positive are split between Kent and Ingham County from that particular outbreak.
All right, I don't have any questions in the queue. If you have a question, please jump in. Go ahead.
I just sent a message, but this is along the lines of, you said that you're investigating an outbreak at a poultry farm. What would, I guess, an investigation like that look like, and how would you address those concerns?
So this is an Ingham County poultry farm. So a lot of it is their investigation when it comes to the facility itself. Just as we've been telling you all along, what happens is contact tracing. So we identify somebody positive, and then we identify who their contacts are. Then we reach out to them. We find out if they're symptomatic or not. If they are, then we get them tested, and then there are more contacts to them. If they are negative, then we have them quarantined for 14 days because we know that they've been exposed. That, of course, in the essential personnel category right now is also modifiable, in that essential personnel who have known exposure can come back to work, but it requires additional precautions by the employer, including the employee screening, which we already do in Ingham County, mask wearing, which is now required in the food supply industry, but not necessarily in workplaces across the board all over the place. The governor did issue a second order about masks that directly impacted the food supply. So groceries, restaurants, those sorts of folks. So I think arguably you could say that this is also food supply. It's just a little further down the chain.
Do you have any idea how many people work at the poultry farm?
Debbie?
I do not.
It's a very large operation, because I did talk to the Ionia County Health Officer about potentially closing the operation. They did close a section of it, and I'm not really sure exactly what it was, but it is a substantial operation that supplies eggs to restaurants, fast food chains throughout the whole eastern part of the United States. So it is not a just shut them down right now thing. We're trying to deal with shutting down certain portions of it and dealing with other things that are going on within the facility through all the different disinfecting and containment strategies and mitigation strategies required for a facility. But again, Ionia County is leading the facility aspect of this because it is in their county.
Thank you. Shirley?
Linda, a question again about congregate living. We've got, according to the state now, 7 cases listed for metallogia of Okemos. Their recent survey showed 66 residents, so that's, you know, a little over 10% of their resident population. And in other nursing homes around the country where this has happened before, it can go from 3 or 4 to 10% to 50% or higher. What's your concern level for them right now? Do you know if any of their staff has been affected there, COVID positive, or is quarantining?
I know that staff at Ingham Medical Facility have been impacted. My brain is not full of all of those numbers right now. So what I would say to you is, in some cases, you're seeing people being discharged to long-term care facilities. And so we then have the cases there, but we also have the separation and the isolation and all of that. So that does exist. That is not metallogia of, you said metallogia of East Lansing?
No, this is metallogia.
Metallogia Okemos.
So 7+ cases right now.
Right. Amanda, are they the ones that have, is metallogia Okemos where those cases went? Yeah,
Yes,
so those
they were
were
released.
discharged. Those were discharged from the hospital to that long-term care facility with all the appropriate standards and precautions. That is not an outbreak that erupted in it.
Okay.
So the other thing I will tell you is, because of the cases we've seen in nursing homes and because of the expansion of criteria to test essential personnel who are asymptomatic, and because of the ability to put that in your public health response plan also to test other asymptomatic individuals, we are working on doing some additional testing in our nursing home or long-term care facilities. And you will see probably some numbers start to increase as we identify asymptomatic positive individuals in those facilities. That is not new. They've been there. So a long-term care facility, I believe, maybe out of the city of Detroit, did some testing broadly across their long-term care facility. You know about the homeless shelter in Boston that did broad testing across their entire population. And, in both cases, you're seeing, as much as a third, maybe even a little more. I think the Boston homeless shelter, it was 36% of those that they tested that were positive, all of them asymptomatic. So again, that's why it's important for us to keep track of enhanced testing and additional testing numbers relative to additional cases. And keep in mind that we do have a lot of testing capacity in Ingham County. And so we may be, I think Detroit has been doing this. The Detroit area has been doing this testing in some of their long-term care facilities, which have identified asymptomatic positives. And you probably will see some of that coming out of Ingham County soon as well.
Can I ask a follow-up there to the metallogia of Okemos?
Sure.
When you say, they've been released to, all the best practices and et cetera of the long-term care facility, you had talked last week about having a local group, kind of a partnership with law enforcement, others to go around. Has that started? When you say that they're up to all the standards, who checks on that? Who would know that? Is that the hospital that discharges them? Is that the state of Michigan, HHS? Is that the county health department? Because there seems to be, as you know, with long-term care facilities, there's a wide variety of ability from one to the other in our state. They're not identical.
Right. So the hospitals do have kind of a system for evaluating that, and their discharges go to the ones that they have identified for that purpose. 2, there are actually state personnel on the ground right now. I just got an email from one of them that's going out and doing audits of long-term care facilities in this county. Yes, our emergency response personnel, EMS, are helping us going and looking at those facilities, and we are in the process of doing it as well. So you've got about 3 or 4 different mechanisms of going in and doing some assurance, doing some training about PPE and infection control to the extent that we see gaps or anything like that, and filling and figuring out ways to address those. So there's a lot of effort going to that right now.
Thank you.
Brittany Flowers, go ahead.
Yeah, Linda, so I was reading through a press release that suicide rates could potentially jump 32% in the state because of the pandemic. I just wondered, I guess, is the state aware of this possibility, and is there anything that's being done to kind of, I guess, help mitigate that risk?
Yeah, so the suicide risk comes in the whole continuum of mental health issues related to this. And as you can imagine, we should have, and we did, anticipate early on that, you know, significant periods of time in shutdown and fear and all those kinds of things are going to contribute to a lot of anxiety, depression, isolation, all of those sorts of things. So community mental health was engaged early on in anticipation of that here in Ingham County, as well as I'm sure in many, many places across the state have engaged their community mental health partners. At the state level, they're working on that as well. And then community mental health here has a hotline in addition to other resources that have been dedicated to that. So we did get that in place early on, and that has been part of our plan from the beginning. As you know, Debbie can again talk to you about special populations. That's been part of our special population planning from the get-go. And Debbie is also a social worker. So chime in, Debbie.
I don't really have a whole lot to add to that. I do think that having the phone number where you can reach out to community mental health is really helpful. I think that variety of, you know, whether it's substance use disorder or if there's some other mental health, you need someone to talk to, those kinds of things. And I think that's been really helpful.
Yeah, that has been, I mean, in addition to suicide, that's been another concern by all of our substance abuse treatment partners is increase of relapses during this period of time. Some of it has to do with access to their regular treatment programs. Some of it has to do with coping mechanisms that often, you know, are related to alcohol or substances that have been a lifelong pattern. And when you push somebody into situations where, you know, they're getting triggered all over the place, they will resort to coping mechanisms that they are accustomed to. So those are also concerns in addition to suicide.
Thank you.
Mm-hmm.
Next, we have Eric Lacey.
Yeah, thanks. Linda, you mentioned 48911. Just wondering here, post-pandemic, what needs to happen for this area to ensure the health and welfare of people, so something like this doesn't happen again where you have so many cases, or, you know, it could be flu or it could be other types of illnesses, knowing there's a lot of people living in close quarters in parts of this area with a lot of apartments, a lot of different challenges.
Yeah, as you can see in the bullet points, the task here is not for just now. It is for emergencies, disasters, situations like this across the board, and I think extends beyond that. And I am going to turn to Debbie now and let her answer the rest of that question.
I do think that there's more data that we need to know. So there is 48911 is disproportionately affected, but the reason why, we don't know all of that yet. And so I do think there's some more data that we probably need to find, like where are some of those folks intersecting with COVID and how did they come? But I do think that we need to look at the health when you talk about individuals of color. Look at the health of those folks in that area, what's over there, what access do they have to different things. And I think that those are some things that we have to look at as we come out of this, and how do we better support individuals and families in that area.
Thank you.
Next, we have Kyle Kaminsky.
I was just wondering if you're referring to Herbruck's Poultry Ranch in Ionia County, or?
That is correct.
Gotcha. And I was also hoping we could get the zip code by zip code breakdown back into the daily presentations. I liked seeing how many in each zip code.
Ah, okay. I took that off of our dashboard online because I think, yeah, but, and it was, yeah. I I specifically took it out because I think it cluttered things. It was easier to look at the map for rates and numbers. If you go to the dashboard, it'll give you the ranges within that, and we show those ranges. So those ranges are pretty tight in terms of telling you, you know, broadly, you know, it's like, what was it, 100 to 110, you know, so we'll look into that, Kyle.
All right. It's not too much trouble. I like seeing it that way. Thank you.
Okay. Thanks for the feedback. Appreciate it.
At this time, I don't have any additional questions in the queue. If you have a question, please go ahead. Oh, Eric Lacy?
Eric's frozen. There.
You see it now? Okay. You mentioned refugees who worked at this poultry farm. Are they still working there? Do you know how many may have been infected?
Debbie?
I do believe there are still some working there. And I do
Not if they've tested positive. They are not working if they've tested positive. Okay.
And I do not know the number in Ingham County. I don't know that number.
I believe Ken Bowen told me that about 1,000 people worked there, if I'm correct. So it's a fairly sizable operation, and absolutely
1,000 people total.
Huh? Yes. 1,000 people total work.
1,000 people
work there.
total there.
Huh? No, there are not 1,000 positive cases there. There are 1,000. They employ about 1,000 people, which is why,
Right.
you know, a smaller operation, we'd have just shut them down with a handful of cases. A handful of cases amongst 1,000, we need to do some work at mitigation and containment and all of that, rather than just shutting down an operation, especially one that's significant in our food supply chain. So that has been the decision so far. Again, it is completely Ken Bowen's decision whether or not to, you know, to shut them down, and it's completely in his court as well to deal with the facility itself. And I will say that our medical director, Dr. Shoyinka, serves Ingham County as well. And so I know that they are in good hands in terms of advice for all of that within Ionia County. So.
Next, we have Brittany Flowers.
So I'm aware of a large poultry farm in Ionia County. Before I even ask, I just want to know if that's something you'd be able to confirm which facility it is.
Kyle just said it's Herbert's.
Oh, I'm sorry. I apologize. My boss just came in and was talking to me for a sec. So sorry.
Yeah.
Thank you.
Now you're all going to write about that, and they're going to be mad at me this week.
Do we have any additional questions?
Just so you know, I don't hide stuff. That's, you know, it is what it is. There's an outbreak at a poultry farm in Ionia County. So I think it's important for people to know. And I think especially given that a number of our refugees that have been infected in that outbreak, that it's important information. So.
Okay. Eric Lacy.
Yeah, you mentioned this poultry farm employs 1,000 people. If there's a outbreak at a poultry farm, do you know if the state is involved in this?
The state is always involved in larger outbreaks in terms of basically advice and assistance to the extent that the local health department may not have the capacity to manage it. So what I can tell you about it right now is that if it wasn't contained and if it was dangerous, it would be shut down. Right now it is contained. It is unfortunately impacting refugees from this community, and that's what's going on. So we continue to monitor it, as does every health department in this region who has cases there, as does the Ionia County Health Department and the state of Michigan. So yeah, there's a lot of hands on that right now.
Thank you.
Mm-hmm.
Dave Ackerley.
Sorry, Linda, I know that my feed's been breaking up left and right. It's been pretty choppy. Could you repeat the name, please, of that farm?
I think it's Herbert's. I don't know exactly how to spell it. So.
Okay, thank you.
Mhm. Keep in mind, an outbreak is more than one case. So, okay?
Sure.
That's what we consider an outbreak. Anything more than one case is an outbreak. So.